Hi, and welcome to the Invigor Medical Podcast, where we're going to walk with you on your journey toward optimal health, performance, and well-being. My name is Natalie.
And I'm Derek.
And we're going to be your hosts on this journey. In each episode, we share insights from top professionals in physical, mental, and emotional health. With that said, let's dive into today's podcast. All right, today we are so excited to have with us Dr. Megan Riehl. Megan is an expert health psychologist specializing in gastrointestinal and chronic health conditions. Dr. Riehl is an associate professor of medicine at the University of Michigan, fellow Hoosier, and co-author of Mind Your Gut, the science-based whole body guide to living well with IBS. Welcome to our show, Dr. Riehl.
Thank you for having me.
Oh, we're so excited to have you. Yeah, we have a lot of conversations surrounding gut health. I feel like more and more it keeps coming up with a lot of the guests that we have on. And I think the last guest that we have on, I mentioned that it really excites me because I think that there's not been enough conversations around gut health for such a long time. And the more science and research that comes out, the more we're learning how pivotally important gut health is to literally everything, that it's, the second brain of the body. And so I'm very excited to hear from you, knowing that you're coming from the leading of psychology as it relates to gut health. That's a super cool, I don't know, I've really considered it in that manner before. Before we really dive in and geek out, as we love to do, I'd love to hear a little bit from you on your history and your background and how you got here to a field that I didn't even know was a thing, honestly.
Yeah. So psychogastroenterology, say that 5 times fast. And if you would have told me that I would be, an expert in this area when I was in graduate school studying to be a clinical psychologist, I probably wouldn't have believed you.
That's fair.
So, who would think that treating IBS every day as a clinical psychologist would be the path? But here I am. Right. Here it is. And the path really is that I studied to be a clinical psychologist. I have a doctorate and a master's degree in counseling and then clinical psychology. And then I did a fellowship, which as a psychologist, you have to do at least 1 year of. I did 2 because that's when I really started to dive into the field of gastroenterology. And really where we are is that we use psychological interventions that have been tailored to address the way the brain and the gut communicate to help patients manage their gastrointestinal issue. So we utilize, things that I studied early on, like cognitive behavioral therapy, to treat patients with depression or anxiety or other mood symptoms. Sure. But
what you would expect.
Yes.
Right.
But the science has really found that we can tailor those types of psychological interventions to hone in on specific health issues, and my area being gastroenterology. And people really respond to this multidisciplinary care approach. So that's kind of what led me to then the University of Michigan, where we have a fully integrated behavioral health program in our gastroenterology division. So even in this respect, there are 3 GI psychologists in our division. We are faculty members of gastroenterology. We aren't faculty members of psychiatry or psychology.
That's crazy and cool.
Very cool.
Yeah.
So it really helps our patients to not feel like, their diagnosis is in their head. A lot of patients that have a diagnosis, and I'm sure we'll dive into this in a little bit, but a diagnosis specifically IBS, have been made to feel like, there's nothing organically wrong with you. You did a colonoscopy. There's no cancer. There's no, organic disease. It's IBS. Good luck. Watch what you eat. Don't get stressed, and hopefully, you can stay out of the bathroom. But, that's not enough for people living with this diagnosis and many other GI diagnoses. And we find that a combination of our behavioral therapies, nutrition therapy, a good gastroenterologist to provide medical care, that's what really helps patients to feel a lot better.
Wow. I'm like, it's kind of really so far out of the realm of anything I've ever heard or thought about that I'm almost like struggling to collect my thoughts and like get into question mode. But the first thing I thought about when you've mentioned IBS, but you said other gastroenterologist,
gastric pathologies.
Let's just say GI. I'm gonna do that from now on. Let's just save myself I've been struggling with words this week.
Edit.
You know, it's been a great week in a lot of ways, but also my brain is a little stretched from this week. It's been challenged in really, really great ways. But I was reading to my kids last night. It was a struggle. I was going blah blah blah, and I never do that. So anyway, we're gonna go back to GI. That's what we're trying to talk about. And you mentioned IBS, so I'm wondering if you could list some other things that might be included. Like I immediately thought of like maybe like Crohn's. Would celiac come into play with that?
Absolutely, yes. So
Okay.
there are different pathways, right? So Crohn's disease falls under a diagnosis of inflammatory bowel disease. There's also ulcerative colitis and proctitis. And so with that type of a diagnosis, the way somebody like myself, a GI psychologist, would fit in is helping people manage the long-term aspects of that disease. So this is different from irritable bowel syndrome, which is falls under the category of disorders of gut-brain interaction. So it might be helpful.
I didn't even know that.
Yeah. So these IBS used to be, falls under the category of what we would used to call functional bowel disorders. And again, the difference between a functional bowel and then something like inflammatory bowel disease is that with IBD, inflammatory bowel disease, there's actual organic disease that's happening, and it can happen really from mouth to anus. And a lot of times patients with IBD require medical management. They need a medication to get the disease under control to prevent longer term effects. And so the pathway to that diagnosis can sometimes be long, and sometimes a patient has gotten a diagnosis of IBS first, and then, through later workups, they identify that it actually is inflammatory bowel disease. So there's lots of different ways that we address psychosocial care in patients that have IBD. You mentioned celiac disease. That's another diagnosis where the medical treatment for that diagnosis is a gluten-free diet. So for celiac disease. And depending on when you get that diagnosis, it can have profound effects on your psychosocial functioning and, kind of how do I live life following such a restrictive diet, which you can definitely do it.
Yeah.
But we can help, connect people with support resources and expert registered dietitians that can help from a nutrition therapy perspective. But all of these diagnoses really benefit from a team approach. And that team oftentimes does include, a gastroenterologist, primary care doctor, and then a dietitian, a psychologist, and the team can really kind of grow from there.
That's great.
Okay. Sorry, I just want to say,
it.
so I mean, you can go because it's probably a bigger question, but like, I just had no idea. I guess to me, IBD and IBS were the same thing. Like, I don't know that I ever separated them in my mind. So to hear you say that IBS is a disorder between the brain and the gut and how they're communicating.
Correct. And we call those disorders of gut-brain interaction now. I kind of skipped over that before, but it used to be functional bowel. And in recent years, they've kind of changed that terminology because functional makes us think what? Like, we'll just function with it.
You're just functional
right?
if it's not working. Right.
Deal with it. But the reality of something like IBS is that the communication pathway between your brain and your gut is dysregulated. And there's really kind of profound ways in which that dysregulation happens. So your motility, how fast or how slow things move through your system, can be altered by a variety of things, whether it be stress, nerve sensitivity, nutrition. There's a variety of ways that your motility can be altered and impacted. And then we also have the bidirectional communication pathway between the brain-gut, known as the brain-gut connection. And in people that have disorders of gut-brain interaction, like IBS, we know that the gut sends signals up to the brain, and there's kind of dysregulation there. And then the brain's interpretation of those signals down to the gut is also a bit dysregulated. And so that can lead to increased pain sensitivity and, again, those, trademark symptoms of diarrhea and constipation. So their symptoms are very, very real. It's just a matter of the way in which we treat something like IBS oftentimes includes a lot of different factors that, like you wouldn't necessarily think of. You wouldn't think, oh, I have IBS, I should go see a psychologist. No. And the reality is you can't just see any psychologist or mental health provider. You really need somebody that understands and uses are what we call brain gut behavioral therapies, which are evidence-based therapies for the management of IBS as a part of a treatment plan that might include nutrition, pelvic floor physical therapy, and a gastroenterologist, medical management.
That's awesome. So just to summarize some of this and maybe just to get some clarification, up to this point, you're essentially saying that there's a variety of gastric pathologies that can happen. Some of them come from just the actual structure or the actual organ malfunctioning in itself, and that those need to be treated, and that kind of falls under the functional category. Is that correct?
When there's disease, so actual disease, then that would fall under more of the like inflammatory bowel disease or celiac disease. Yes.
And so then the other option is essentially something that has more of a neurological base that then is affected potentially by stress levels or the parasympathetic or sympathetic nervous system kind of firing up in different ways. Is that correct?
In a way, yes. So we can come into an IBS diagnosis, even from a post-infectious perspective. So somebody that goes to vacation, they come back a week later, either on vacation, they're in the bathroom nonstop. They're like, oh, like I just, my gut is terrible. And then they come home and it doesn't get better. They may be something where either it was something they ate, a parasite, some kind of an infection got into their gut microbiome and altered things, and then they can have what's called post-infectious IBS.
Interesting.
And so other times we can be diagnosed with IBS at childhood, the kids that have the constant tummy aches and ultimately then end up with a diagnosis of IBS. And then we can, be adults and have that diagnosis kind of come up. So the pathway to IBS is different for everybody. But the same is really true for other GI diagnoses as well. So inflammatory bowel disease can be diagnosed along the lifespan, and same with other well-known diagnoses such as celiac disease or GERD.
Great. So it sounds like essentially people that have these issues, you specialize in this so that you can come in and you have a very unique set of tools that you can help them with, like a very holistic kind of treatment care approach, where they're working with their dietitian, they're working with their PCP, they're working with someone that specializes in gastric conditions. But you come in with another set of tools that can help ameliorate a lot of things on the psychological end as well.
That's right. And sometimes the psychological therapy is basically also like gut-directed hypnotherapy is something that I specialize in. And it helps patients that have been refractory to other IBS types of treatment. So patients that have failed medication, they've failed nutrition therapy, they're just not getting better. Gut-directed hypnosis is effective in between 66 and 80% of those patients.
Holy cow.
Wow.
So
meaning it's just, you're saying gut-directed hypnosis, but it's just hypnosis that's focused toward the gut.
Correct.
Weird. That's so
well,
crazy.
The brain and the gut. So giving suggestions.
Right, of course.
Exactly.
Yeah.
Yeah.
Wow, that's so fascinating. Okay, we want to dive in, to some details here, but maybe just take a moment for our listeners to help them understand, help all of us understand why gut health and gut microbiome and all of this is so important. Maybe, because I'm guessing there can be varying levels of the intensity of some of these conditions that, so somebody's feeling some discomfort or noticing, regularly having these issues, but it's not enough to like really put them out. So like, no big deal. But maybe explaining why it's so important for us to have good gut health.
Yeah. So, gut health matters for all of us, and things that can impact our gut, number one, are things that we all do. We have to eat, right? So if you're finding that, maybe you're not pooping regularly, or maybe you're going too much, that may be a sign.
Well, that's a good question, though, because you hear a lot like, what is regularly? Right?
Now, that varies for everyone, but most people ideally are going to get up in the morning, and within about the first 30 to 60 minutes, they probably are going to get an urge to go, especially like if you've had that first morning coffee and you get an urge to go. That's normal. That's healthy. That's your gastrocolic reflex that's working for you. And so it's really important to not ignore that. So for anybody that's a little bit shy and they're in the office and they get that urge and they're like, no, I don't want to go in. That's really, we dissuade you from doing that, because that's just your body giving you its signal and that you want to go and, get the job done and on with your day. Yeah. Now, some people might go back for a second bowel movement, maybe after lunch or maybe after dinner, and that's fine. That's fine. But if you're going multiple times a day and you have abdominal pain, we want to get that checked out.
Yeah, for
if you're not going, so if you go 3, 4, 5 days without going to the bathroom.
Cannot fathom.
I can't even imagine.
Yeah.
That's not also normal. Some people can go.
They gotta be uncomfortable.
Some people can go 3 days actually, and that's their normal. They go once,
Wow.
But we're speaking generally. If you're going multiple days without going to the bathroom, we want you to get checked out. It's colorectal cancer awareness month. And so
really?
Yes, 45 is the new 50.
And that's a month of March, just to clarify, right? Because I think this is probably going to post.
So month of March.
The month of March, yeah. Okay, so I'll say that again for you. So the month of March highlights the importance of colonoscopies. So you may be hearing about that in recent months, that, colorectal cancer awareness is so important. It's a preventable type of cancer, and it's preventable by getting your colonoscopy, right?
Wow.
So if you're somebody of average risk, meaning that, you don't have a family history of colon cancer, you're having pretty normal bowel movements, you have no alarm symptoms such as blood in your stool or, nausea, vomiting, then 45 is the new 50. 50 used to be when we get our first colonoscopy. It's now 45. And if you do have a family history of colon cancer, then you really want to talk with your doctor about when you should get that colonoscopy. So, I think that gut health matters for all of us, because what we eat, what surrounds us, our environment, it all impacts our gut microbiome. And gut microbiome diversity is important for all of us, and
diversity in all things.
Exactly. So we want to be eating nutritious foods. We want to be mindful of, how we treat our body. We only have one, and also just generally, stress can impact us, not only our gut but our immune system. And so, by no means am I like an a-hole who says just don't be stressed, because how do we live in this world without being stressed?
Right. For real.
But have, awareness of your stress. And if it's really high and you're having bloating and abdominal pain and bowel fluctuations, that may be an area that maybe you want to kind of look into.
Yeah, that tracks. It totally makes sense.
Very interesting.
So now I'm trying to think, where do we go first, right?
Well, I do have a question. So one of the things that you talked about, I had a friend a while back, I won't name him, but he told, like, at one point he told me, he's like, yeah, I can only use the toilet. I can only poop at home. And he told me, he's like, there was times where, like, I would be out camping or I'd be on some like school thing and I wouldn't put poop for like 3 days. And I'm like, dude, that's insane. I can't imagine that.
Yeah.
And so I'm guessing that this is, I don't know how common this is for people to experience that type of discomfort. Obviously it's like there are times when, like, you're on a road trip and you're going into the gas bathroom station and you're like, this is nasty. And you're like, maybe I'll go to the next one. But, like, for the most part, I think that a lot of people can kind of go through that. But as a psychologist in this field, how would you work with someone with that type of condition to kind of like help them overcome that?
So that's a perfect example of things that we help patients with is, anxiety drives avoidance. And so what he's describing is he's anxious to go into the bathroom and it's embarrassing sometimes, or we can perceive that it's going to be embarrassing to, have the things that happen in a bathroom happen in public. And so we'll work with people to identify, did they ever have a really negative experience where they went to the bathroom and did somebody make fun of them? Or, is it a really small office setting? Or, we work through how are you thinking about this stressor? And how do we maybe think a little bit more flexibly around how to cope with it? And so also organically, is there any medical issue that we can address from a medical perspective? Sure. Are there any medications that he may benefit from to make his bowel movements a little bit more regulated? But in that instance, it's oftentimes more so about addressing the GI specific anxiety and giving them tools and strategies and resources to manage, what we think could be really anxiety provoking, and helping them to recognize, actually I could handle this. And if it's a classroom of 26 kids, guess what? 26 out of 26 are pooping. And your teacher poops too. And your boss poops. And, the Pope poops. Everybody poops.
Who is it? There's a book by Trevor Noah, Born a Crime. And in it, he actually says that the exact same thing. He's like, everyone has to poop, even the Queen of England. That's right. And I love that. Like that image burned in my mind. I'm like, great. Now I'm just going to be thinking about that for who knows how long.
Yeah.
But yeah, everyone does it. It's something that connects us all.
It's something I've never thought about it as something that connects us all. That is a wild thought that we're all connected.
Hey, I hope you're enjoying today's podcast. I just wanted to take a quick break because if you're listening, you probably know what we do here at Invigor Medical Podcast, but maybe not what we do at InvigorMedical.com. So let me introduce us. At Invigor, we provide prescription strength treatments and peptides for weight loss, sexual health, and lifestyle optimization. Every treatment plan is carefully prescribed by licensed doctors and sourced from legitimate pharmacies. You don't ever need to buy questionable research chemicals again. And bonus, as a podcast listener, you get a 10% discount on your first treatment plan with code podcast10 at invigormedical.com. Now, let's get back to today's episode.
And it's something that we don't talk about enough. And we certainly talk about it in my home. I have 3 little kids, 2 boys and a girl.
Sure.
And, they'll fart or they'll talk about, I gotta go potty. And I'm like, yes, buddy, we all do it. But yet, I see so many patients that have come in feeling embarrassed to talk about it. They'll say oh, I know you probably talk about this all of the time, but I don't talk about this ever. This is embarrassing. This is something we never talked about in my family. This is something I feel shame about. And so if people are carrying this around, imagine just the tension that might produce in your poor little stomach. Especially if that's as a child. And then we carry that as adults. And so for some of my patients, just the opportunity to normalize that, look, go to the bathroom. Don't hide this. If you're with a partner who makes you feel bad about going to the bathroom, that's not the right partner for you.
For real.
So we can still have modesty about ourselves, but let's not, pretend like we're not humans that have a digestive process.
Yeah. Okay, so we've obviously talked a lot about poop and that being an indicator maybe that you don't have good gut health depending on how much or how infrequently you're doing this. But I'm curious, what are some of the other markers for people to pay attention to suggest maybe they need to get their gut health checked out? And I think this is going to be really important for people to hear because in my experience, a lot of times people have been progressively deteriorating in how they feel at such a rate that by the time it's almost bad or really bad, they're so used to not feeling well that it doesn't stand out as something that could be a problem, right? And because I've heard so many people that are when they get a diagnosis or they change their diet and cut out gluten or whatever, and they're like a new human because they're I did not realize how bad I felt. So I want to make sure we take a moment to, beyond poop, and I think we've mentioned one or two other things, to talk about like what are some of the markers that people should pay attention to know, hey, it's time for me to go get checked out and see what else might be going on here.
Yeah, you brought up a big one. So if you have started to restrict your diet, and now you're eating only, a few things because X, Y, and Z makes your tummy hurt, or you get bloated, or it sends you to the bathroom. If your diet has become extremely limited, then that's definitely a sign. Yeah. And it makes sense. A lot of times food is perceived as a culprit to GI issues. We have to eat too. So it's this, it's the connection, right? We have to eat, we have to fuel our body. And especially if you've looked on the internet, there's 1,000 different restrictive diets out there. There's 1,000 different supplement regimens. There's 1,000 different recommendations on how to manage digestive issues. And when we look at the science, yes, there are some nutritional remedies out there that are science-based, but you really should be doing that under the care of a registered dietitian who specializes in gastrointestinal health, and also that you have received a proper diagnosis by a doctor. So, definitely restricted diet. The other thing is if you're having any blood in your stool, or if the color of your stool is very different, so very dark stool or very, very light stool.
Unless you just had a blue slushie from the 7-Eleven, because then it's really normal for it to not look right.
Or Captain Crunch.
Captain Crunch.
Or beets.
I mean, also, though, not great things for you.
No. Maybe that's part of the issue.
Well, but you know what? There are some really nutritional foods out there, too. Beets, cherries,
True.
So, but yeah, that is a good marker, too, that if you otherwise are doing just fine and like you have all of a sudden you look down at the toilet, you're like, holy cow, what is that? Like,
what is going on?
A quick assessment of what did I eat yesterday? Might be important.
For sure.
So I'm just, because I'm kind of percolating now, because I was just thinking about all of the ways that the gastrointestinal tract intersects with psychology. And one of the big ones that I think is an obvious one that stands out to me, and I don't know if this intersects into your realm of work, but like disordered eating and body image issues and, body dysmorphia. Could we touch on those topics a little bit?
So the literature shows us that about 50% of patients that have eating disorders also have IBS.
Wow.
So this is interesting because an eating disorder like anorexia we diagnose that because people are restricting their food to address their body image. It's to lose weight. There's the psychological component of it. And so then that can lead to alterations in your digestive system, right? When you're restricting so much food and depending on the type of eating disorder that you have, that can really impact your motility and can lead to a diagnosis of a gastrointestinal issue. But then we also see, this is a newer area of research in GI, this diagnosis called avoidant restrictive food intake disorder. And it used to be
Avoidant restrictive food intake disorder.
It's a mouthful.
Avoidant restrictive food intake disorder.
Also known as ARFID.
Okay, there we go.
There you go. So ARFID historically was a childhood diagnosis for kids that were really picky about their food. And so they would restrict. They were really picky about their food. Then they had very limited amount of food. And they also would say, because it hurts. It hurts. I'm limited. I don't. Well, when you think about that, we've now researched it. And really, we're in the earlier stages of researching this in GI issues. But we see this in a lot of our GI patients. They're not restricting food because they want to lose weight or because of their body image specifically. They're restricting foods because it hurts. And so there are cognitive behavioral therapy protocols now to help patients that have been diagnosed with ARFID in the GI patient population. And what is critically important is that both you as a patient need to talk with your doctor about your relationship with food, because a lot of times our patients are saying, like, I want to eat. I don't want to be, restricting so much. I really want to expand my diet. I just don't know what to eat. And then a gastroenterologist or primary care doctor can hear that and say, okay, great, let's get on top of this now before this develops into a full-blown eating disorder. It's a slippery slope. And so if you as the patient are talking with your doctor about this, they're now in the know. They're looking at, have we developed any malnourishment? Is there any supplementation we need to be looking at? Do we need to make sure that everything is checking out okay? And then also let's work with a dietitian. Let's work with a gastroenterologist, because even people that don't have a full-blown eating disorder, they still might have anxiety as they're expanding their diet again, even under the direction of a GI dietitian. So I put on the patient a little bit, but then if you have any, medical professionals that are listening to this, also important for us to ask patients with GI conditions, what's your relationship with food? You might do an eating disorder screener, but I find just having open conversations with people to then guide their treatment planning gets a lot of good information about what they're eating, when they're eating. A lot of times patients will also restrict food all day. So they don't eat because when they eat, they get bloated or gassy or their symptoms perk up, and then it's hard to get to work. It's hard to get to school. They have to use the bathroom. They don't want to. So they make it all day long. Then they come home and they eat a ton. And then they go to bed. And so I always say, the digestive process likes to happen in the upright position. Let's let gravity work with us.
Yes.
So if you're eating a lot right before bed and you're eating the majority of your calories before bed, and then you're laying down, it's no wonder you're going to have worse GI symptoms later that next day. So we want to help patients to kind of have this empowered perspective of knowing the right ways to kind of go about their nutrition, so that we don't see things progress into more of an eating disorder as they are trying to navigate food and their symptoms.
Sure. That makes sense to me. Okay, so these things might go hand in hand. I want to talk about your book. Right. And what that's all about and why it's important for people to read. And I also kind of want to have a picture and understanding of when you sit with the patient, what you're actually doing and what are you walking them through. And I'm just so fascinated with the whole connection between the brain and the gut in general. I am. And now in this specific area, I'm dancing around in this room, woo, where do we go first, right? So you pick. Where do you want to start, with the book or what it actually looks like walking through things with the patient?
I think I can cover it along the way, right? So the reason,
okay, perfect.
Yeah, the reason I co-wrote this book with a registered dietitian. She's world-renowned expert in GI nutrition, Kate Scarlatta, and I approached her because I'm fortunate to work with GI dietitians where I'm at. And so our patients do have the opportunity to see a gastroenterologist, a GI psychologist, a registered dietitian who is expert in many of these nutrition therapies, and patients get better. But our program is one of a handful in the country. I'm one of about 400 GI psychologists in the world. And so when you think about IBS specifically, there are about 45 million Americans that have IBS.
Wow.
And that's
not a good ratio.
No. So, and those are just the ones that we know about, so we think about 1 in 5 people that do have IBS have never talked to a medical professional about it. 1 in 4 are managing their symptoms just with over-the-counter medication and hoping for the best. So there's a lot of people out there that are living with these symptoms, and they just don't have the roadmap to get better. So knowing that there's also a limited number of GI dietitians, I thought, what about if we partner? You cover all the nutrition stuff. I'll cover the behavioral. We'll work together to help people understand the diagnosis of IBS, as well as IBS mimickers. So things to kind of be considering, like inflammatory bowel disease, or sucrase isomaltose deficiency. These different things.
Say that one 5 times.
Yeah. Lots of different things to think about. So we outline those IBS mimickers for people too. And we encourage, get that proper diagnosis and then consider these different tools for your toolbox so that you can live a life that is not staying away from the things that you've been missing out on, so that you can travel, so that you can go to work, so that you can eat with your friends, so that you can date. People avoid things, and we just wanted people to know that they can live well with that diagnosis.
I love that. That sounds really, I just had no idea how, I mean, I guess it makes a little bit of sense now, you saying there's only 400 like you in the world. It now makes to me a little bit of sense why this is something I'd never even heard of, because, Derek and I both are, very into, listening to podcasts on health and wellness and reading books and having conversations and follow lots of those people on social media. And so there's a point where you feel like you've heard of something for sure by now, after years and years and years of being interested in this field. So it makes sense now hearing that number, but it's a little startling to hear the ratio with 40. Did you say 45 million?
45
people?
million Americans. Yep.
Americans, not even in the world, just Americans.
Globally, the prevalence is about 10% too. So
wow.
That's incredible.
It varies from 6 to 10% depending on the literature of the presence, but it's prevalent, and people's approach to it historically has been medication. And, in recent decades, it's shifted to looking at nutrition and the role of nutrition, and seeing that, wow, people can get better following certain, nutritional regimens. But now, we've entered the sphere of brain gut behavioral therapy. And, and now, people are more interested in going more of a holistic route than having to feel like they're only reliant on a medication.
Yeah,
well,
which I think is good.
Yeah, I think that's absolutely fantastic. I think that it's such a wonderful thing for you to have put this book together. Obviously there's so much need for it and so little resources for it. So I think it's absolutely phenomenal, and makes me excited that we're having this conversation.
Yeah, me too, to get the word out so that people know. Because I can also imagine if you're living, with or without the diagnosis, right? Like whether or not someone's told you this is the issue, or you're just dealing with the symptoms with no diagnosis, I can imagine that it would feel debilitating at times.
Hopeless,
especially if it's, it worsens and it just really kind of takes over your life, right? And, like you said, like wanting to be able to date and like go do these things and go camping and all these things without, facing these issues. It can feel hopeful to get a book like this in your hands.
Well, and I would imagine it'd be like, I'm trying to think, it'd be like if you went and got some sort of diagnosis, and, if you get the IBS diagnosis and there was no supporting, resources to go with it. You're like, hey, yeah, there's something wrong with your gut. We don't really know what. You're just gonna have to figure it out on your own. It's like the kind of the helplessness of like, okay, shoot, now I need to figure this out. Now I have to go and sift through all this information. There's all these influencers that are saying X, Y, and Z. Apple cider vinegar is gonna help my gut.
It'll be fine.
Yeah, I'm just gonna do the carnivore diet. There's all this kind of information bundled with misinformation. Like the fact that there's a registered dietitian that helped you write this, that you're an expert in your field and that you're doing what you're doing, I think is absolutely phenomenal. So with that being said, something that I'm really interested in is getting into what some of the actual therapies of this would look like. You've already mentioned cognitive behavioral therapy, CBT, and
hypnosis.
I think, and hypnosis as well.
Yeah.
I would be interested to dive a little bit more into the CBT of like, what does that process look like? And if there's any other tools that you recommend to patients.
I would too, because I feel like you think about psychology and like, I just imagine like someone sitting in the chair and just being like, well, my tummy hurts a lot and I'm not pooping.
Tell me how you feel.
Tell me more. Tell me how you feel, right? Because that's what we associate psychology to be.
Tell me about your relationship with your mother.
Yes. Yeah.
I mean, even if that is applicable,
Yeah.
but I just mean that like it's a limited view on what psychology is. So I want people to understand what role this is actually playing in the healing process.
Yes. So there's no couch. There's no bell going off and clucking like a chicken. I don't own a pocket watch.
Is there a bust of Sigmund Freud in the corner?
I don't own a pocket watch, she says.
Okay. So cognitive behavioral therapy and gut-directed hypnosis have the most evidence to support their use in in working with patients. Predominantly, the research focuses on IBS, but we've found, they're applicable to other diagnoses as well that fall along the brain-gut axis. So with CBT, one of the ways that I like to help patients start to see how we incorporate this is by describing something called the GI stress cycle. So this is something that's outlined in our book. And if you start at the top of our cycle, it's like you get a gurgle, a cramp, a spasm. Maybe you're going to the bathroom for about a diarrhea. So you have that symptom. And for a lot of our patients, it then leads to this cognition of, oh God, here we go again. I got to get out the door. I can't be late. My boss is going to think I'm unreliable. This is embarrassing. So those thoughts, those unhelpful, in the CBT world, we call them automatic thoughts. Those unhelpful thoughts start to get revved up. That then leads to these feelings of embarrassment, anxiety, frustration, negative emotions. They're not going to be good emotions. Yeah. Now that then leads to an increase in our sympathetic system. So this is where our brain-gut connection really starts to get kind of amplified. We feel our heart rate increase, our breathing gets shorter and shallower, our muscles kind of clench and tense, and that's when then you probably feel it more intensely in your stomach. You might run to the bathroom more. And that arousal of the sympathetic system then leads to worsened GI distress, which then kicks us into this cycle. So when I describe this early in sessions with patients, to get the head nods, and they're like, yes, that's me. That if I didn't have those symptoms, I wouldn't be having all these thoughts. I wouldn't be having all these problems. It's the symptoms that kick off the cycle. And so we'll talk about how with CBT, which is really kind of outlined very, simplistically with how you think impacts how you feel, which impacts how you behave. If you change how you think, it's going to change how you feel, which is going to change how you behave. If you change how you behave, that's going to change how you feel, which is going to change how you think. So if we jump in at any of those factors and work on, flexibility, cognitive flexibility, giving you different ways to relax your system, that's going to impact how you cope with these symptoms when you feel that gurgle, cramp, or spasm. So CBT is pretty structured in terms of first helping people identify their thinking, identify their thoughts associated with feelings, physical feelings in the body, and then also giving very tangible resources around, we call it modifications of arousal. So basically teaching them relaxation strategies. That when you're ramped up, when you're feeling that cramp or spasm, one of the first things I teach people to do is diaphragmatic breathing.
Okay.
So I can get into that for a second just because it's a nice takeaway for any of your listeners.
Yes, please. Yeah.
So the reason I teach diaphragmatic breathing to pretty much everybody is that that sympathetic system that we all have built into our body, which is meant to keep us safe, but unfortunately, it's like an alarm system. So it goes off at times when it's really not life or death. So it was built in to keep us safe from the lions, the tigers, and the bears. But it now might go off with a gurgle, a cramp, or a spasm. So that sympathetic system kicks off. Well, what can we do about it? Well, we have the beautiful parasympathetic system that its counterpart, and that's your body's relaxation response. So we could activate that relaxation response by calming our system. And diaphragmatic breathing is one of the things that does that. So it's a 4-second nice inhale through the nose. Your belly will rise. And then a nice 6-second exhale through the mouth. Your belly will fall. Now, a lot of times my patients have said, oh yeah, a therapist taught me breathing techniques at some point. I don't use them. They don't work. Or it's a temporary Band-Aid. And I'm like, okay, but hear me out. So yes, number one, it can serve as a little bit of a distractor. So if you shift from those unhelpful thoughts and start to calm your breathing down, that's great. I will caution, that's not treating anxiety management. So diaphragmatic breathing is a Band-Aid. It is. It's not getting at the root of why you're anxious. But I'll take it in the beginning of our sessions because I want you to feel some wins here, okay?
Well, and you can't really be therapized well when you're in a state of alarm. We got to get into calm and relaxation in order for any of this to stick, I'm guessing.
That's right.
Well, and it's a powerful tool to be able to move from a more alerted state to just becoming calmer. And just like Natalie said, that's absolutely necessary for any type of treatment.
But get this. So our normal chest breathing doesn't move our diaphragm. When we move our diaphragm, it actually produces a calming, soothing, massaging sensation on our digestive organs.
Interesting.
Ooh, an internal massage.
So
I love it.
From a GI perspective, it can help if you're having cramping and urgency. So if you get that oh crap moment when you're driving and you feel like you have to go, but you're 5 minutes or miles away from the nearest bathroom, the best thing that you can do is shift into that diaphragmatic breathing, because you're going to get this nice little internal massage. And instead of activating further high levels of cortisol and adrenaline in your system because you're worrying and you're stressing, you're actually regulating some of those stress hormones. So it can produce this nice, resolution in a way to the urgency. And you might still have to go, but you can at least get to the bathroom and you're not making the situation worse. On the other end of the spectrum, so if you're constipated, being seated on the toilet, a lot of times if people are constipated, they're bearing down and they're holding tension. Doing diaphragmatic breathing on the toilet will actually help, again, relax those muscles so that you can have a more productive bowel movement.
Interesting.
So teaching something like that, a behavioral strategy that relaxes the system in like session 1 with people, helps with that buy-in of like, oh my gosh, I felt so hopeless and helpless to manage these symptoms. And now I have this one technique that she's told me I have to practice for the next 2 weeks, many times a day. But time and time and time again, people come back and they're like, oh my God, it worked. It was helpful. Again, it's not going to be the end all be all, but it's a nice kind of introductory tool to help you see that, look, we can calm your system down. You do have some strategies that you can turn to in the moment. It's just, do we panic or can we implement something that's a bit more productive for the moment?
Yeah. Oh, I was just going to say, I think it's absolutely incredible that you touched on that, because it's such a simple tool, but it's incredibly powerful. And like, you talked about the diaphragm. I feel like the diaphragm doesn't get as much love or limelight as some of the other organs. But you talking about how it kind of like can rest and kind of give us a massage to the intestines. It reminded me of now, for all those people listening, this is where I'm going to mention Huberman. he actually, I think on his Instagram, he actually had like a GIF or a video showing the diaphragm, that when you're breathing in, it puts pressure on your heart. And so it actually causes your heartbeat to go faster. Something along those lines. So it's like when you take a deep breath in and you hold that, it's making your heart like kind of pound faster, and it's really activating that sympathetic system, like making you more nervous. And so by allowing yourself to breathe out and really relax, and then in turn also have the diaphragm massage your intestines.
Well, and you just get a deeper breath when you do that. Like I learned like diaphragmatic breathing in vocal lessons in high school.
Yep. So my singers are really good at this.
Yes.
For me,
and
it's swimming.
Literally, my vocal coach taught me how to inhale without actually feeling like I was inhaling, specifically just on moving everything in my gut down and out, creating space for the diaphragm to expand. And as the diaphragm would expand, it was almost like creating a vacuum in my lungs, and they would naturally expand. So I was able to get air at the bottom of my lungs, which was necessary to create pressure to hold and put out a good note for good tonal quality. But like, I think we walk around like tight abs, like let's keep it tucked in, and then, but when you're doing that, you're like limiting to just up here, and you really don't get a full complete breath without doing that. But now to think about when I'm doing that, I'm also like loving on my insides and give them a little massage. Like, I love that. That's a great little bit of self-care there.
That's right. And you also bring up another important point, that so many of us are just comfortable being uncomfortable.
Oh my gosh.
And I'll point out, hey, drop your shoulders. Just what does that feel like? And
relax your jaw.
More times than not, people who are you're having a general conversation with them, they're like, I didn't even know. Like, I didn't even know I could do that. So, passive muscle relaxation is something that we teach our patients. And actually passive muscle relaxation, where you start at one part of the body, I always start at the hands, and you kind of work your way through the different muscle groups, is built into hypnosis. So the gut-directed, our other big guy in the show, so gut-directed hypnosis is another strategy where we build in some relaxation, but then we use very tailored and targeted suggestions about the calming, the soothing, the functioning of the digestive tract, often incorporating imagery related to nature. So we give people kind of this nice peaceful scene, and then while the conscious mind is, really open and suggestible, we give those suggestions that help with the management of IBS and restoring the way the brain and the gut are communicating.
I'm glad you brought up the hypnosis again, because I was I'm like, okay, we're running short on time, but I want to make sure we talk about it because it's such an interesting. I think hypnosis in general is something that people are like, ooh, really? What's that? But like in this context is even more interesting. And I can imagine, when you're talking about visualizing things, it's got to be a little bit difficult, and probably why it's necessary to have this guided hypnosis session. Because like you don't know like what your guts feel. I mean, it's like an internal thing, but it's totally different than me like knowing what it feels like to extend my arm and bring it back in, or to roll my head on my shoulders. Thinking about what's moving inside my digestive tract is just, I wouldn't even know how to like have a frame of reference for that.
You don't have IBS.
Oh, sweet. Well, then good to know.
No, I'm making
diagnosis for free this time.
I know you're teasing.
But a lot of people that do have these diagnoses, they are so hyper aware of the happenings inside their gut. And the term for that is actual visceral hypersensitivity. So what that means is that, like, let's say I have IBS and you and I go out and we have lunch. We have a salad and pizza and a cocktail. And so if I have IBS, immediately as we're ordering, I might be going, oh God, I don't know if this is a good idea. Like, this might not be the best idea for us, but I'm going to eat it because I'm here with my friend and it's going to be fine. It's going to be fine. Well, we're done and we're kind of chatting and I'm starting to feel this gurgle. And what I'm now focusing on is the gurgle. There's actual nerve sensitivity in my gut that's also now sending signals up to my brain saying, hey, did you feel that? And my brain is saying, oh, yeah, I felt it. Want me to turn it up?
Danger,
I'll turn
Will
it
Robinson.
up for you. And then that's where our kind of nerves and also something called GI-specific anxiety or visceral anxiety, where the sensations are now causing anxiety, ramp up. And I'm then in the bathroom and you're fine. You're like, okay, like, let's go out. Let's go.
Pizza was good.
Want to go to
let's
a
go
movie?
Margaritas.
You know, and so the person with IBS is able to probably also have a gurgle, maybe pass some gas, but you're not thinking about it in the same capacity because your stomach sensitivity is not the same. So the hypnosis gets at that. It gets at those sensations in a really beautiful way. And a lot of us that do this are using scripted protocols that have been time tested in research. So these are evidence-based, science-backed strategies.
It's not just a bunch of mumbo jumbo, folks.
No. And in fact, the good news, again, for listeners, is that we've found these protocols to be just as effective virtually and also delivered via apps.
Good.
So,
good.
So the Nerva app is a gut-directed hypnotherapy app.
Okay.
And if you don't have access to a GI psychologist, I think it's worth a try in terms of they're using, again, science-backed, strategies. I have no financial ties to Nerva, but we mention them in our book because we think it's a good alternative for somebody that might not have access to this type of treatment, and you can download it.
Clearly not everyone does.
Right. You can download it right from an app store. So, there are products in development. The world of GI and digital health is aware that we need patients to have more access. And so more products are out there on the market and more are coming to the market. So hang tight.
Good. Okay. All right. So we're getting close to end of time, but I want to make sure we get to our section of fact or fiction. It's my best game
All
show.
right.
Best voice. There's a reason I do a podcast and not a game show. And I was just thinking of a fact or fiction that we don't even have on here.
Let's do it.
Okay. So fact or fiction, if you're burping or farting a lot, it's a sign of GI problems.
Probably fiction, because, you know, burping and farting is pretty normal. We all are going to pass gas. But if you're doing it, I would say excessively, and or if it comes with a lot of really stinky burps or farts, then I might say,
Like
you know,
died.
I would consult with your doctor. But, you know, if it's happening after your meal and, you know, you move on from it, that's normal.
Mm-hmm. I'm a big burper after a meal.
Yeah.
Oh,
In
yeah.
fact,
Let that
and,
out.
You know,
Do you take the Shrek approach?
oh, I let it rip.
Better out than in, I always say.
Exactly.
I have to catch myself sometimes. And my mom used to make us put quarters in a jar when
that's
we
funny.
belched because it was like,
That
because she was
jar
so
would
tired of it.
Be able to fund the treasury.
Yeah,
you
and
know?
I get it now because now my daughter's doing it, which it's partially my own fault because I do it, and she has no shame,
No,
right?
no.
She's a 6th grader, and she's just and her friends think it's hilarious. But I even still do it. Just walking, it's just me and my friends. We're on a walk. I'll let her rip because I want to see how I can get it, which is so ridiculous. I'm a 38-year-old woman, and I have not grown up.
Oh my gosh.
Okay, you do the next fact or fiction.
All right, let's see. So some of these are, it sounds like might not be right in your wheelhouse, but if you want to answer it the best you can, we'll take
Okay.
it. So fact or fiction, you must take probiotics when you take antibiotics.
So the thing that makes this fiction is that you must. Not everybody needs to take a probiotic, period. Not everybody needs to take a probiotic when they take an antibiotic. If you're somebody that is on an antibiotic and you are having horrendous GI symptoms with your antibiotic, I'd talk with a doctor. They may recommend probiotic supplementation, but the important thing is that they'd likely recommend a certain strain depending on what antibiotic you're on and the symptoms that you're having. So I caution definitely if like you're at the pharmacy and like there's a probiotic stand right there when you're getting your antibiotic, that's not for everybody.
Okay.
Awesome.
Gotcha. Okay, this one might be a little more in the dietitian realm as well, but fact or fiction, consuming raw vegetables is better for gut health than cooked vegetables.
Okay, this is also kind of a fact or a fiction because I say vegetables are important, period.
Get vegetables in your diet.
And so
right?
if you can, you know, some days have cooked, great. If some days it's raw, great. So I think ultimately there are going to be some vegetables that might cause you to have some more, you know, GI symptoms than others. Sometimes if people eat like a ton of broccoli or cauliflower, they're like, whoa. But I ask how much they had, and they're like, well, I had the head of cauliflower. And I'm like, well, okay, so moderation is the key. So I would say that, you know, the more important thing is that you're eating the rainbow when you think about your vegetables. So the more diversity and color that you can have,
Skittles.
I don't care if it's raw or it's you know, cooked. Let's work on that. And then if you're really struggling with certain sometimes people have a harder time digesting the raw vegetables. Then we might have to make some alterations. But ultimately, I just want people eating their wide range of vegetables.
Yeah. I love broccoli. Steamed broccoli with butter is like my favorite side vegetable. And I really do enjoy it raw, like I like to make my ranch dip at home. It's a good way to get the kids to eat their veggies.
Oh, yeah.
But I realized in the last year or two, I can only have a few pieces of raw broccoli. If I have because I'll just keep going and going because I love it. I am not well afterwards. I'm just like pain, just that I'm like, what is happening? Lots of pain.
Yeah.
Sorry, that's a Knight's Tale quote.
Dude, Knight's Tale is my favorite movie.
Shut up.
Straight
And I've never
up, my
quoted.
favorite
Anytime
movie.
I say pain, I'm always like, pain.
Lots of pain.
That's me and broccoli.
Your entrails will be your extrails.
Yes. It's such
Your
a good
extrails will be
motto.
your entrails.
We
Dude.
geek out on way more than just health
Awesome.
and nutrition.
Awesome. Last fact or fiction here. I'm going to modify it slightly. Eating fermented foods every day can improve gut health.
Can improve gut health. Yeah, it can. Fact. Again, it's about finding the things that work well for your body. So, you know, if you are eating kimchi every day. Now, great. That's, for live cultured fermented foods are great for diversifying your gut microbiome. But if it's too spicy or it hurts, then we want to modify. But I think,
or if cruciferous vegetables make your tummy hurt,
you got to modify a little bit there.
Yeah.
So I think just being mindful of how the product is made and how you feel with it, and always consult with a registered dietitian if you have specific questions about expanding your diet and how you can play with your food to help your gut feel better.
It's funny because your mom always told you not to play with your food.
Yeah.
But here we are.
Play away.
Got to play with our food, kids.
Play away.
It's time.
Yeah. There's a lot of play with food around our house, and that's okay.
I love it. Thank you so much for taking the time to chat with us today. This was so illuminating. I'm sure our listeners are going to find it illuminating as well. And I want to say thank you for recognizing the need for this book and filling that gap for people that may not have access to the kind of care that you're able to offer with your team. Where can people find you and your book?
Yeah, so the book is available where all books are sold, Amazon. I'm hoping it's in some small bookstores too, because I love to support those small bookstores.
Oh, I love that. I'll have to go check it out in my Walla Walla bookstore.
Yeah. Ask them. That's the other thing. If you go in looking for it, ask them to bring it in. But it's available internationally. So I actually just got the copy of what's going to be available in Europe and Australia and New Zealand. So
you're
That's
global,
awesome.
girl.
Yeah, so it's available, worldwide, and then let's see what else. Kate Scarlatta, you mentioned her. We have a podcast as well called the Gut Health Podcast.
Oh, that tracks because you were very natural here. Not everybody who's really smart at the things they're teaching and writing about is also really comfortable on mic and on camera. So it tracks that you do your own podcast.
Okay. Well, thank you. We're very new at
You're
this.
welcome.
We just launched, and we have new
That's
episodes
exciting.
once a month.
Congratulations.
And
Awesome.
We're having fun with it. So it's very science-based, but we like to have fun and kind of talk about real life.
Not us.
Exactly. That's
we
why
don't
I
do
felt
fun here.
very
No,
comfortable with you two.
Good. Okay, social media where people can go to find you?
At Dr.
See your
Riehl,
posts?
so DRRIEHL on Instagram, X. That's where I hang out the most, I think, is Instagram.
I still have not gotten used to Twitter being
I
X.
know.
When people say X, I'm like, what platform's that?
I know.
I haven't heard of that
I
one.
know.
It's weird. Yeah. Okay. Anything else, Derek, that you wanted to add in?
No, I just wanted to say thank you so much again for the incredible work and the undertaking that you're doing to provide this information to people. Because I can just imagine, like I said earlier, people that are in this, that have received this diagnosis and there not being that many tools really accessible for them. Just having another tool this is science backed, verified evidence, verified by experts. It's like absolutely phenomenal. So thank you so much for joining us, and we're excited to be able to share this message with our platform.
Yeah,
absolutely.
Thank you so much for having me on, and I greatly appreciate the opportunity.
Wonderful.
Thanks for tuning in to the Invigor Medical Podcast.
If you enjoyed today's episode, you can support us by liking and subscribing.
Your feedback matters, so feel free to share questions or future episode ideas in the comment section.
For more information about our prescription strength treatments for weight loss, ED, and overall wellness, all from qualified doctors and reputable pharmacies, visit us at invigormedical.com, and don't forget to use code PODCAST10 for a 10% discount on your first treatment plan. Until next time, stay well.